At Hoag, we've been fortunate to build the Orange County's only multidisciplinary comprehensive tumor program for pituitary tumors. This involves a wide range of specialists, including neurosurgeons, ear, nose, and throat surgeons, endocrinologists, ophthalmologists, radiologists, pathologists, who all come together to provide these patients comprehensive multidisciplinary care.
And the members of the team have a very wide breadth of knowledge in other aspects of their specialty that have a very positive impact on outcome from those patients, because they bring into it a whole lot of collective experience from other aspects of their specialty.
The pituitary gland has many different functions. In fact, we call that quote-unquote the master gland, because the pituitary gland is the main gland that takes charge of how the rest of the glands work in our body. So it has some relationship with the adrenal gland, with the thyroid gland, the female, male glands. So it has many different functions that are very critical for the function of the body.
The interesting thing about endocrinology as part of the pituitary program is many people don't realize that that is one of the most important pieces of the ongoing care of a pituitary tumor patient. Endocrine controls your entire system, and many endocrinologists don't necessarily have the comfort level with pituitary patients or want to focus on that in their practice. So with Dr. Choi, she's very skilled and very willing to take the time to understand these patients' endocrinology and their physical well-being.
If a tumor develops in the pituitary gland, the effects can be profound and wide-reaching. These patients can suffer from obesity, diabetes, poorly controlled blood pressure, high cholesterol, inability to regulate their heat and cold. It can affect their skin quality, their bone quality. They can have effects on their mood and a psychiatric situation. I think it can cause depression, anxiety.
Well, a nurse navigator in the pituitary program is a very integral part of facilitating patients' care. Diagnosis of a pituitary tumor can be very complicated and difficult to manage. And my goal is to make sure that the patients are seeing the correct providers in a timely fashion.
With very few exceptions, pituitary tumors are managed primarily through surgery. We've made huge advances in the last 10 years with the technology and the techniques to be able to remove pituitary tumors through minimally invasive approaches. The endoscopic technology with ultra-high definition endoscopy, using intraoperative navigation, as well as numerous other technological advances have significantly increased the safety and efficiency of these operations, allowing us to remove the tumors using the nose as a natural portal without any scarring, with very quick recovery, and with minimal risk to the patient.
So my role is to dissect through the anatomy of the nose, face, and skull base in order to gain a wide open and safe pathway for us to approach tumors in this region safely and effectively. Because if you can't see the tumor completely, you don't know if you're taking the whole thing out.
The beauty of transsphenoidal resection is that patients usually stay in the hospital for a day or two, and much of that is to manage their endocrine side effects from the surgery.
Probably the number one thing that sets us apart is experience. And now the patient does so well because the surgery is done with such minimal impact on the patient that they have very few, if any, symptoms after the surgery. Maybe a stuffy nose for a little while, but no significant headaches, no leakage of brain fluid, none of those other types of things that can potentially happen with these operations.
Here in Orange County, we are the only comprehensive pituitary center for pituitary tumors.